Welcome to Point Blank, platform where we discuss issues confronting Africa. I am Ricky Brown and your host. People with mental illness in some part of Africa are chained in dark corners of churches. Some are even locked away to live behind bars or filthy prisons. And some suffer severe trauma that leads to severe physical illnesses. Discussing this issue about mental health illness in Africa, I have Dr. Peter Hughes, consultant psychiatrist at St. George's Hospital, London, who is also a member of Royal Psychiatrist College, London, who has done over 10 years of mental health work in Africa. And also I have Mr. Prince Achampon, a medic with a special interest in Africa's development. Gentlemen, welcome on the show. Yeah, Peter, I'm starting with you. You having been in Africa working for over 10 years on the mental health field. What's your experience? If you give us just a brief experience over the 10 years.
Well, I think I've hard to give a short synopsis, because each country I've been in is so different in Africa. I can talk about Southern Africa, like Malawi, which is totally different to West Africa, Ghana, Sierra Leone. Absolutely. And then the East Africa, another country I work quite a bit in, Somaliland, is very different again, and Sudan. So I've learned a lot about mental health, and I really have learned as well how mental health, as you've mentioned, is not talked about. It is missing from the radar of people. And the things you describe, people being chained up, locked, being beaten up, stigmatized, are probably the one thing that I've seen in all the countries I've been in Africa. I've seen developments over the years, things getting better, I've seen things getting worse in other places. So all in all, I think there's a lot to do, and there's also a lot I can learn from there as well. I come from outside, I work in London, and there's things I've learned, tremendous things from Africa, and I can use in my practice as well.
So, Dr. Hughes, what are the most common mental health conditions in Africa?
Well, it's really hard to say exactly, because there isn't a lot of data around. But we do know that things like depression and anxiety are very, very common. People will talk about anxiety, though. They can say, I'm nervous or I'm scared. Depression, maybe people don't talk about so much, and we think that that's very common. And I've seen it, and I've seen it affecting people's lives badly. Then you've got the more dramatic conditions like schizophrenia, psychosis, which is rare, but it causes significant problems for that person and their families. And I've seen people with schizophrenia. Every city centre I go to in Africa, I'll see someone who's looking psychotic, who's talking to themselves, or maybe abandoned by their family. So those people are every country. There's also things like substance abuse, which is probably more than we think. And that varies between countries. Like in Somaliland, which is a Muslim country, there'll be less alcohol.
Right.
But then they have another thing called kat, or chat, which people chew. If you go to other places like Southern Africa, alcohol. But it's often those sorts of things are hidden.
So those things in relation to drugs and alcohol, is it because the government and the mental health department, let me blame this on the government, they don't really have any legislation regarding the use of alcohol and other hard drugs and so on?
Well, I would say I live in Britain, and there's a problem here as well, where there is a lot of legislation. So I think that things like, I don't want to blame the governments, because they've got so much to do, and there's such a lack of resources for everything. But I think it's probably a function of poverty and disadvantage. If you're under stress, you are more likely to turn to alcohol or drugs. why people are under stress. That might be to do with the government, because maybe people don't have advantages, or they don't have a job, or proper housing. So I think all those social things come together to make it a recipe for people taking drugs and alcohol.
Right. And then in your experience, do you think our cultural practices have influence when it comes to mental health illness in Africa?
I think it's been both good and bad. I think that what I really appreciate going to Africa is the strength of families, and that families can really be a strong support for people with mental health problems and protect them. But I've also seen the other side where families think someone is possessed by a spirit or a jinn,
Right, yeah.
try and beat them up or chain them, and so it's been both good and bad. There's some cultural practices which is not like positive practice, like for example domestic violence, which is worldwide. But some places it's unquestionable that it is common and accepted in some places. And as an outsider, I'm always there to say, well, no, it is not acceptable. It's not a cultural practice that's culturally acceptable by anyone.
All right. Thank you very much, Dr. Hughes. And let me come to you, Prince. You being African yourself, do you think our cultural practices influence mental health? Because you will agree, maybe if you go to deep villages and so on, someone will start showing signs of mental illness, and they would not take the person to the hospital to see a doctor. They would, oh, let's try this traditional medicine and so on and so forth. What's your take on that, Prince?
Peter has already said a lot, even though he didn't grow up in Africa. He knows quite a lot and he said a lot. But then, from having lived in Ghana and been to some African countries, I realized that cultural practices do have ill effects on the outcome of mental health conditions and how people see people who live with mental health problems. The thing is, in Africa, fortune and some ailments are seen as being cursed by the ghost. Okay, so anytime somebody starts to behave in a very odd way or start showing signs of problems with their mental state, they tend to say that, oh, this person is being cursed by the ghost, and no one wants to have anything to do with them. They might be showing signs of severe psychosis, but because they believe that it is the work of the ghost and they are being punished because of what they did, no one seems to listen to them, no one seems to want to care for them, and so you see them on the streets. Okay, so I think culturally something needs to be done.
Right. Thanks for that, Prince. And Peter, let me come back to you. When you were talking, you mentioned something that really clicked my mind. You said something, if people are suffering from mental illness, family are sort of support for these people. But in recent times, we can see Africa is developing. And when development takes place, urbanization takes its toll. That seems to break away families. So in that situation, how do people suffering from mental health get their support? That family element of support. What do people get that from there?
Well, I think that there's a lot of urbanization, but even still, things like family and religion are so important in all the African countries I've been to. And that's, even though families might be displaced or whatever, refugees, I think still that cohesion in the family is really, really strong even now. I've also can think of year before last working in Sierra Leone with Ebola was so strong, and people were terrified, and everyone had terrible anxiety, including myself. And we just got support and managed For me, it was by the people I was working with and the others around me, and by the people there. It was just their religion was very important, their community, and I think we haven't got that yet to that place yet where people don't have families around them.
Okay. So,
Can
yeah,
I
sure.
fill in something?
Yeah, sure.
I think family is very important, and as Peter has rightly said, but then urbanization, as you rightly said, I think that it's actually contributing hugely towards mental health problems. If you go to Ghana or Nigeria, you do realize that most people with schizophrenia and psychosis are people in their early 30s or say early 40s. And most of these young men are the ones who tend to move from the villages to the city centers to find jobs, because they have problems with work and they have poverty and everything. So people tend to move to the cities a lot more. And because they might be in the cities on their own, I mean, when they have these episodes of psychosis, there'll be no one to look after them. So most times you see them on the streets, going through rubbish dumps, looking for food. It's not because the families don't really want to look after them, but urbanization has caused a shift where we don't really have that support anymore for these people. So I think you're right. I mean, I think urbanization is also
breaking
causing
that family support that people with mental illness faces. And Peter, coming back to
I certainly agree. I've seen those people in the rubbish dumps in the cities as well, and I think it's maybe it's an increasing phenomenon.
Right. And Peter, with your experience, how do Africans manage with mental health conditions?
Okay. Again, it's hard to, because Africa is not one country. It's
That's
so many
right,
different
yeah,
countries.
different regions.
So I
right?
could say, I'll just give some examples. Like in Sierra Leone, it was religion, it was community, it was music, it was dancing, it was, actually I can think that's probably for many countries in Africa.
Right.
Those sorts of things that really help people. Certainly people with mental health problems are far more likely to go first off to a traditional healer than any medical or nursing person. So I think that's how people cope as well when there's a problem. And there's also things people do like chaining up people and tying people up as a more negative sort of way of dealing with people. And then there's one of the programs I'm very involved in a few places is trying to make healthcare and mental health care accessible to people so that they can get the health care at the primary care centre, even if it's in a rural area or remote, that the doctors or nurses or social worker are trained up to pick up mental health problems and know enough about it to manage most mental health problems.
Yeah, that sounds very interesting, Peter, because I was reading one article that I came across. Looks like, let's say, whole of Europe, let's say the population is about 800 million or so, and it has about 80,000 psychiatrists like yourself. And in Africa, where the population is over 700 million, we only have like 12,000 number in psychiatrists that we have. How would these people cope with the number?
Yeah, I think in the West we're certainly lucky to have the resources we have, and I think it'll take many years for Africa, for example, to catch up and have that sort of psychiatric manpower. We are trying to encourage people to go into psychiatry, doctors, nurses, etc. But I think that in the meantime, I think it's really just important at a village level, at a community level, everyone knows a bit about mental health, and that we have community programs, destigmatization programs, so people don't have stigma against people with mental illness. Although it is so strong in some countries, I know in some countries where people have talked to me about witches and warlocks, and like they were talking about, like it was like they got a degree in it at university.
Oh, did those things scare you, or did it make you have different perception about Africans?
Well, that did, because I hadn't come across it so strongly, and when I talk to people about mental health, usually I can come to a stage where people will think, well, we don't think this is a spirit possession, let's try something else. Well, we usually say to people, did your other treatment work so far, which might be a spiritual or religious treatment, and then we could look at this other model. So, but in some places, I think in a trip recently, that strength of feeling about witchcraft was a bit unshakable. And for me, coming from outside, that's which is a religious country, and we have certain beliefs as well in our country, but that level of strength of belief was really hard for me to conceptualize.
Right, and in your opinion, do you think policymakers in Africa are really taking mental illness seriously at all?
I don't want to be unfair to them because there's so many competing interests. But from my point of view, and I think the view of the need, no. Because we know that mental health problems affect about 1 in 4 people. And if you're poor and disadvantaged and female or disabled, the chances are you'll have more adversity, and if bad things happen to you, your mental health gets worse. And if your mental health is worse, your physical health is worse. For a mother with mental health problems, it means she can't look after her children as well as she would like to, and that affects the children.
Because when they are neglected, they tend to have some sort of psychosocial effects on them as well.
So it affects the future of the country as well.
Exactly. Right.
So I think it should be a really important area, but we now have the Sustainable Development Goals, which have some elements about mental health. There's something about substance abuse, I think suicide as well. So there are some ways that globally there's going to be something about mental health which governments have to listen to and take seriously. There's also the WHO World Mental Health Action Plan, which every country, I think, if not every country, has signed up to, which is about putting mental health as an important area, that people have access to mental health throughout the country, that there's prevention and promotion programs, that supply of medication is, I think that's some of the ways that globally mental health can be advocated for, as well as at a village level.
Thank you for that, Dr. Hughes. Prince, let me come to you once again. Do you think we as community, are we doing enough to help people having mental health conditions back home?
Well, thank you very much for that. And I think Peter is trying to be very kind to African leaders, but certainly I don't.
Maybe he doesn't want to offend no one.
I, for one, wouldn't be kind to them because it's no brainer. If you think about it, the top 10 most disabling physical conditions or most disabling problems, mental health is actually one of them. Okay, so if he rightly mentioned 1 in 4 people in Africa suffers from mental health, that means that at the moment we don't really see African leaders doing a lot of talking about mental health problems.
It's not about doing the talking. What about if they're doing the talking but they're not walking the walk to actually execute
that's
something,
what I meant.
to putting some stuff in place to help?
They are doing nothing. If you go to, say, Ghana, if you go to some of the mental health hospitals in Ghana, you'll be amazed, how things are run. Some wards don't even have water supply. Some places don't even have electricity. If you go to Nigeria, there are no beds for some of these patients to actually sleep on. They are still using chains to stop people from hitting the streets. You know, we are in 2016, and you still see people with mental health problems walking the streets of Accra, which is to be the capital city of a country, and they see this all the time. No one does anything about it. If you go to Ghana today, it was in news quite recently that one of the top mental health hospitals don't have medication for their patients. Why should this be happening? Okay, at the highest level, they don't care. These governments don't really put any incentives in the training of mental health professionals.
I just give
so
you
reliant.
a random figure, a random country like Tanzania, which has about, it's interesting when I came across this, it has about 34 million people in the country. And the whole country, 34 million, they have 10 psychiatrists and about 1,200 psychiatrist nurses and only 2 psychologists. And only one hospital that has 1,600 beds, catering for 34 million, should, in case someone breaks down for mental health conditions. I don't think this is actually adequate. And this is just one country, and there are some countries which even have only 2, and some even don't have none at all.
And it will surprise you to know that even some of these countries with psychiatrists, most of them are not even trained in those countries. There are so many people like Peter who leave their comfortable homes to Africa, all because they can't even think of how people are suffering, and they go to help. So our people, our leaders, what are they doing? What policies are they putting in place to sort of help tackle
that brings
these
us
issues?
a question. Well, Peter, what really motivates you to step in, to go out there, to give a hand to Africans who are having issues with mental health?
That's a good question. I'm not sure I can answer it. I know that I can find, there's nothing I love to do more in my life than to do my work in Africa and other places. It is totally, completely satisfying. It's just a joy to be able to do it. But I'm not going out, I hope that I'm not going out there to do things to people and to bring my great Western wisdom. It's really like a partnership, and I've learned so much. I go out there, I do a lot of training, which is helping people build up the skills and knowledge that they have already. I can go to a country, Burundi, which I've never been to. I do not know the culture there, but it's helping people learn about themselves and how they can build up their skills using their own culture. So that is kind of the thing that gives me a great joy. And when I go back to a country again and again, and I see that actually things have got a bit better, in spite of all the negative stuff that goes on about how mental health is so little considered. And when I see cases, I was just thinking of a case I saw in Uganda of a woman who was coming to a primary care clinic and looked really depressed, and I could see it. But the doctors and nurses there hadn't been trained in mental health, so they didn't see it. And I asked about her story, and they said that she comes here every week. She's got problems with physical symptoms, problems with her children, and what happened was they'd missed that she had depression. So the joy I had was actually being able to help them think about this lady having a depression, treat her, and she would come to the clinic less often, but she wouldn't need to. She'd be able to look after her children better. The other thing I might mention though about mental health is that we know it's not expensive to treat mental illness. It's very cost effective and simple. and treatments. Drugs are really important, but there's other treatments that are really effective and simple, like some simple or different types of talking treatments can be very effective for mental health problems. Group work, all these things, which are don't involve a lot of resources. And I do think that if the governments could actually see that you can make a big gain with a little resource, and how hugely that would benefit the country, maybe if they could see that, they might think differently.
Yeah. It looks like mental illness is not given a very good attention when it comes to making decisions or on the agendas of the policy makers, let's put it that way. So Prince, in your opinion, just like Peter mentioned, he said there's something like talking therapy which is not expensive. What are the African leaders waiting for? What are the policy makers waiting? You being an African, your side of the story. Why are the leaders dragging their feet to step in to tackle something which is very, very important for the well-being of the people?
I think, as Peter said, most of our leaders, I think they don't really know much in terms of what goes into treating somebody with a mental health problem. The fact that it looks like, and people believe that these patients are cursed, and that treating them would involve some sort of spiritual intervention, and the sheer thinking that it might take longer to treat these people actually sometimes scares them in terms of how much money would be involved. Like if somebody's got a headache, they might take a painkiller, and the next morning they'll be walking up the street, and they'll be fine. However, in terms of mental health, it might take up to a year, or because maybe these leaders are not aware of some of the things Peter just mentioned. And so they themselves, I think they need a bit of training. They need to reach out there, maybe get people from the West to sort of share some light or educate them in terms of how best to tackle the problem. But the thing is, if they haven't really sat down to think about how best we can help these people, how are they gonna come up with this idea that we need somebody to talk to us about how best we can help the situation without spending a huge sum of money? So I think, as I go back to what I said earlier, they seem not to be interested, okay? So somebody somewhere needs to make them aware of the fact that, look, people are dying. Mental health problems is actually one of the top 10 ailments that cause disability in the country. So deal with it. If you deal with it, it's cost effective, it's not as expensive as you might think it is. And I think taking it from there, they can actually look into it and try and help the situation.
All right, thanks for that. If it looks and then it feels like people with mental health conditions in Africa are being abandoned by the government and being forgotten by the aid community, as well as being neglected and abused by society. We're going for a short commercial break and we'll be right back.
Life is an adventure. Sometimes we climb, at times we descend. Sometimes we smile, at times we frown. We laugh sometimes and we cry. These are all the events of life. And we document these events to tell the stories of our life, of where we were and how far we've travelled. Chris Vick Entertainment is a video production company that can capture these events of life and package it on a DVD, be it wedding, christening, birthday or funeral. Give us a call on 079577 88401 and you'll be glad you did.
Caring for the mind is as important and crucial as caring for the body. In fact, one cannot be healthy without the other. Peter, let's start from you. What is the way forward in this situation? How do Africa overcome this whole situation and try to make something to help our people who are in this kind of mental health conditions?
Well, I think the solutions will come from Africans, not from outside. But I think that the big world organizations can put people in the right direction. So some of the things are, some of the strengths that are there already in Africa are the communities, sense of community, the cohesion. Religion is a really important factor for people as well, and I always see that as really positive and part of the treatment as well. My special interest is in the MHGAP program, and I brought along my sample copy, and this is the training manual we use for helping people learn about mental health in primary care, so they could use this manual and treat most problems of mental health. And then if there's problems they can't deal with, that there's a way of accessing an expert. In most countries in Africa, you'll find that there's at least one psychiatrist, and that psychiatrist is probably going to be in the capital city. So that's great if there's one that you can contact. Also, one of the roles we've had in the UK as well is being a source of advice and support for people as well if they have internet or our phone. The other one is the humanitarian version, which is used particularly for refugees in conflict settings, which there are plenty in Africa. So both of those, I think, are a good way of putting mental health into primary care. That's one aspect. You've also got to deal with the public awareness, and that has to go at all levels of the community, at a village level, religion, traditional healers. I think everyone has got to be aware of the place for mental health. Also in general medicine, a lot of people with mental health problems present with medical problems, or physical problems, like aches and pains, headaches, stomach pains, things like that. And I think the physicians, the nurses got to be made aware that could be a mental health problem as well. And also I think a good thing would be people with mental illness can speak out themselves about what it's like and how they've recovered and what they've learned from the experience.
Yeah, I think that's not a bad idea. But what about if they're speaking and no one is listening?
Yeah, I think I can think of places that I've been to where there's been people who are really strong at speaking, and if they've done TV programs, they've done media, they've gone out to schools, they've spoken to the people in the ministries and the presidents and said mental health is really important. And I think it can be a force of personality. It can be hugely important. The other thing, actually, just to mention, is sometimes you can take advantage of bad things like that happen. And there's WHO talks about building back better. And this is one of the things we'll be looking at in Sierra Leone, where we have had the terrible Ebola, and how we can take advantage of that to build things back better than before. Because everyone after that is kind of in a state of shock and trauma, and there's a culture of being able to try new things and learn new things, new ways of approaching things.
Right. Thanks very much, Dr. Hughes. Prince, I'm back on you again. When the question have to do with something got to do with African leaders or African governments, what do you think our governments back home should be doing in addition to what Peter just mentioned to tackle mental health conditions?
Yeah, thank you very much. Peter has said a lot, and from all indications, it seems that the physical ailment departments in Africa are very well developed, okay? And we know that governments, for some reason, are not really interested in mental health. But the doctors who work in physical health actually know the effects and implications of mental health conditions on people's physical health. So instead of leaving this for the government to do, why don't they take that upon themselves and start to make some noise about mental health problems? Because in the end, it comes back to them. Let's say if somebody with schizophrenia walking up the streets gets attacked by somebody and through the trauma ends up in A&E in a place like in Accra or Kumasi. These doctors have to deal with their physical problems and in the end also have to find a way to tackle their mental health condition. Now, after dealing with their physical health, where do they take them to? There are no places to look at the mental health problem. So they should take up that challenge, make some noise, speak to the government about the fact that, look, even though we are not directly affected by mental health problems, this side of health is lacking. So they should start putting together data. So if somebody comes from the West to help, they
have the rough idea on what
to show
they
that,
should
look,
work on.
okay, this is some data showing that the governments are not doing a lot. From there, they should also, actually a lot will depend on the government. Okay, so keep on making that noise. Now, if there's no data and the government decides to listen, what have you got to show? Nothing. So taking it from there would help. And also, as a community, we do know that these faith healers, religious leaders, have huge implications on those with mental health problems. Why don't we integrate them? Train them instead of just training.
Do you think when we integrate them, it will work out?
I think
Do
so.
those
I think
medicine really works?
if we tend to enhance the understanding of some of these problems, because what I do know, based on my experience in Ghana and some parts of Africa, what I do know is these people don't believe in some of the drugs and treatment approaches taken by Western medicine in the first place. So if you pick them up, show them what the problem is, and the fact that what they're doing, because they are involving these people, trying to tame them and get them incorporated within some of the activities in the church premises that they do, that's what helps them get better. So teach them to understand the problem in the first place. Whatever they know traditionally that actually helps the mental health problem should be left alone. But once they gain the understanding that, oh, okay, so this is the problem, and with what they know as faith healers, put those two together, I think it will really go a long way.
Okay.
Because in the West, talking therapy, that's a lot.
Okay.
So if these people are doing that already, why don't we increase their understanding of the problem?
All right.
And work together and help
Thanks for that.
solve the problem.
Dr. Hughes, let me come to you one more time. We're finding solutions, but let me draw you back a little bit. What about the stigma? People with mental illness have been stigmatized. How do we break away from that stigmatization?
And I think what we know is that if you know someone who's had mental health problems yourself, or if they're in your family, that is one very powerful way of getting over stigma. So that familiarity. So thinking of the leaders of all the countries, I'm sure there's members of their family who might have mental health problems, close or distant. So I think that's a way of getting them to think about mental health problems. I can think as well as where I ran a clinic where we had, it was a mental health clinic, but we had epilepsy cases. And firstly, people thought epilepsy is a spirit possession.
That's right.
And then we had one child who came along, and the child got treated successfully. Word of mouth went everywhere. And then we managed to be able to treat all the epilepsy in that area. And then we got to see people with psychosis, because people thought, well, maybe we'll try that now, because the traditional healer didn't actually work this time. So that was one way of overcoming stigma, because people could see results, and they could see that their affected family member was actually recovering and getting back to life.
Right. Thank you so much, Peter. Prince, bringing the conversation to an interesting end. What's your last word and any suggestion you would think people should, any step they should take in order to draw attention to mental health conditions?
I think for a long time, Africans have held this belief that mental health problems are caused by spiritual sort of, or have spiritual causes. I think it's about time they need to learn and understand that the same way the physical body can go wrong, the mind can also be affected. And the various governments of the various African countries should also know that mental health problems actually is one of the top 10 conditions that disable people.
So they should
take it seriously. As Peter said, it's very cost effective. And so treating mental health problems is in a way dealing with the economical and poverty or lack of employment problems in the country, because these people can actually contribute hugely towards the development of their communities. And so it should be taken seriously.
Okay, thanks. And Dr. Hughes, your final word. Any words for people who really want to come into the industry and help, or any advice for the people watching with mental health
I think
conditions?
the advice for people in Africa: shout loudly. If you've got positive stories about people who've recovered, if it's yourself or your family member, it's other people. It'll be a great inspiration for others to hear that you can get over mental illness and be
a good quality life. And when you see, I think one thing that's always heartens me is the number of people I've seen who've been chained for many years, and they are eventually found for whatever reason. Often it's because of some training that's enabled them to be found. The chains are removed after a process, and you can see their quality of life is so much better now that they're unchained, and they're not
trying to be violent or causing problems.
One more question, Peter. What about if someone sitting home is interested and wanted to be trained as a psychiatrist or a psychiatrist nurse, or so, who doesn't work at the primary care level? What advice, or how can the person have access to the WHO partnership that you are involved?
Okay, well, the documents are free on the WHO website, and they can contact their local health department to see if there's any trainings happening. For anyone in UK, I run regular trainings as well in this for any UK reviewers. But for the rest of it's if they ask for it, and if you shout loudly enough, and you might give your governments a headache, but if you ask loud enough, eventually you might get it, and they might set up a training, which really can change things for the better.
Right. Okay. Thank you so much for your time, Prince and Dr. Hughes. It's been a pleasure having you on this discussion this evening. People, we have to bring our conversation to an end. But former U.S. President Bill Clinton once said, "Mental illness is nothing to be ashamed of, but the stigma and the bias attached to it shame us all." Thank you for watching, and have a very good evening.